Yesterday, we confirmed the first case of Ebola contracted in the United States in a healthcare worker who cared for who we refer to as the index patient in Dallas, Texas. Our thoughts are with this healthcare worker. She is now being cared for, and we understand that she is clinically stable. If this one individual was infected, and we don't know how, within the isolation unit, then it is possible that other individuals could have been infected as well. So we consider them to potentially be at risk, and we're doing an in-depth review and investigation. I want to clarify something I said yesterday. I spoke about a breach in protocol, and that's what we speak about in public health when we're talking about what needs to happen. And our focus is to say, would this protocol have prevented the infection? And we believe it would have. But some interpreted that as finding fault with the hospital or the healthcare worker. And I'm sorry if that was the impression given. That was certainly not my intention. We need to consider the possibility that there could be additional cases, particularly among the healthcare workers who cared for the index patient when he was so ill. That's when this healthcare worker became infected, and we're concerned and would unfortunately not be surprised if we did see additional cases. They're looking at the types of personal protective equipment that are used to see if there are some types that might be easier to put on or take off and thereby reduce the risk that someone would unintentionally contaminate themselves. We're looking at what we do when someone comes out of the isolation unit and possibly spraying them down with a product that would kill the virus if there is contamination. That was already in our guidelines for gloves, but we're looking at that more broadly.